What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase, list it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
Who hides Easter eggs that you never want to find? The Dust Bunny. What do you call a dirty PowerPoint presentation? Mudslides. Why did the art collector buy an old septic tank? It's filled with mass turd pieces.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network Studios. Produced by Adam Goldstein. It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner who gives me street cred with the wacko alternative assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
This is a show for people who had never listened to a medical show on the radio or the internet. You got a question you're embarrassed to take to your regular medical provider. If you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical stuff, and news you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, respiratory therapist, etc., etc., etc. All right. Hello, Dr. Scott.
Hey, Dr. Steve.
Don't forget to check out stuff.drsteve.com, stuff.drsteve.com. For all your Amazon needs, it really does help keep us on the air whenever you shop that way. So you go to stuff.drsteve.com. You can scroll down, see stuff we talk about on this show, including that crazy weird sex toy thing that blows air. It's bizarre. It's down at the bottom in the adults only section. And then, or you can just click straight through and go to Amazon. So it's pretty cool. Thank you for checking it out. Check out Dr. Scott's website at simplyherbals.net. And please don't forget our Patreon, patreon.com/weirdmedicine. We're doing some fun things over there. We haven't done an exam room in a while, but I'm getting ready to get some lined up. The exam room is where we have a celebrity come in and ask us questions. So it's like an inverse interview. And if it sounds like my dentures are not tight enough, it's because I'm on the last dregs of my Invisaligns, and it is weird getting used to having my teeth all lined up properly.
So does that mean you're going to sing more?
No.
Oh.
But it means I can do cameos.
There you go.
Oh, yeah. Check out our Cameo, cameo.com/Weird Medicine, I think. Just search for Dr. Steve Weird Medicine. I'll say fluid to your mama. It's Father's Day coming up. I'll say secretions to yo daddy. I'll do whatever you want me to do. If you want Myrtle or Cletus to say hello to him, we'll do that. I'll even put I have a Myrtle wig, and I'll even put it on. I don't care. It's like $7. It's the cheapest cameo ever, and I just do it for fun, but it's fun. But what sucked was when I first started doing it, it said, I would do it, and I'd look at myself, and it looks like I'm missing a tooth. But it was because that one was so far behind the others, and I couldn't get it, just hold the camera just right. So it didn't look like I was some toothless bumpkin from Tennessee. Doctor or no. So I did get some effing Invisaligns. And the other thing is there is a chance when I retire of doing a little bit of TV work, and I didn't want to have to deal with it later. So I'm just dealing with it now. But it's way better. I mean, I could tell with the second Invisalign when I flossed that there was more space. And now they're like, if we stopped right now, I'd be totally satisfied. So anyway.
That's fun.
That's pretty cool.
That's cool.
Fucking Invisaligns. And I will tell you this, the way it works, the ones that you buy from, where you send them off and they send them back to you and it costs half of what the Invisalign is, I don't see how those could possibly work. There is a trick involved with the Invisaligns that there's no way that they could do on one of those. And it has to do with putting little post things on your teeth to hold them in to make sure that the movement is correct. And I don't know how the ones where it's just liners that you put in your mouth could move your teeth around. I just don't see how it works. But anyway. All right.
Cool.
Don't forget to check out Dr. Scott's website. It's simplyherbals.net, simplyherbals.net. And I see we have in the studio audience, in the waiting room. No, that was the wrong drop. That's more appropriate. We have Adam Goldstein, quite the celebrity of Adam Goldstein TV, where I got this drop from.
Why can't you give me the respect that I'm entitled to?
That was Adam was gracious enough to let us use that drop from his. Not that he owns it. I don't want to get him a DMCA strike, but anyway. And who else we got in there? Well, we got Jimmy Rustler and got Sean Pedrick, who won the ticket for the celebrity roast that I'll be participating in September in Rochester, New York, at the Comedy in the boy, I better do better than that. September 17th. Comedy at the Carlson. And is the roast of Carl Hamburger and Vinnie Paulino. It'll be fun. Even if you don't know who they are, it'll be a fun night. Mm-hmm. And if you're a Weird Medicine listener and you happen to be there, you come say howdy do, I'll buy you a beer.
Sounds good.
Assuming that you're not sober. And if you are, then hearty handshake. All right.
Now, how many people other than Sean actually entered the contest? Was there one entrance and he
yeah, Sean entered the contest and he won.
Way to go, Sean.
There you
like
go. Asshole.
All
right.
That'll be cool.
So we've got some news to discuss. And one of them, Dr. Scott, if you have the article on the cancer cure that's gotten all the hype in the news, that would be a good one to start with, because there was quite a bit of hoopla about this this story, if I may be, use salty language.
Yes.
So do you have that article?
I do, yeah. it's pretty incredible. Of course, the title is "Every Single Patient in the Small Experimental Drug Trial Saw Their Cancer Disappear."
So the headline is "Every single patient saw their cancer disappear."
Insane.
Right. Okay.
Never heard of that ever.
All right. Right.
Yeah.
So what does the article say?
Well, it's talking about it's specifically for rectal cancer.
Correct.
And I guess last year 340,000 people died of rectal cancer.
Of course.
And
it's terrible.
It's a terrible disease. And before this trial, the treatments were radiation therapy, surgery, chemotherapy.
If you catch it early, it's curable.
Yeah, but if you catch it early enough, it's curable. But there's a lot of course, trauma associated with the treatments.
Yeah, because it's if it's in the middle of your colon, you just take it out and sew it back together again. That's harder to do when it's your rectum, which, by the way, you never think about your rectum until something happens to it, and then that's all you can think about. Mm-hmm. So what else?
And they were just saying that out of, I guess, 14 patients, all 14 patients, after 2 years showed complete resolution without any side effects from the chemotherapy or from this treatment.
So this sounds awesome for rectal cancer patients, but the problem is it's kind of horse shit.
Okay.
So, and it's kind of, this is still a really important study, but it ain't what it was made out to be in the news media. So I went to the original study. This is what you have to do. And if you want to read along with me, go to drsteve.com. And if you're doing this the week of June, what is this? June 15th?
Yep.
Then it'll be the top story. And if it's not at the top, just go to the search function on our website at drsteve.com and put in rectal cancer. It should come up. Here's the study: is PD-1 blockade in mismatch repair deficient locally advanced rectal cancer. That is the title. It's by Andrea Cherchek and a whole bunch of other people. And that is a pretty nondescript title for an article that got play in every newspaper in the world, basically. Mm-hmm. So what I thought would be fun, and I did this on the Patreon show, so the Patreon listeners are ahead of everybody on this one because I did that last week. And you can go to patreon.com/weirdmedicine, by the way. But I thought it would be good to do it here because it's kind of an important study. So here, I'm just going to go through the abstract. We could go through the data in the article if people are really interested in that, but that should probably be a sidebar. But it says neoadjuvant chemotherapy and radiation, followed by surgical resection of the rectum, is standard treatment for locally advanced rectal cancer. So let me just translate that because there's a lot of stuff to unpack in just that sentence. So neoadjuvant chemotherapy and radiation, this is where you give someone chemo and radiation in the hope that you can shrink the size of the tumor so that when you take out viable tissue, you're taking out as little as possible. Mm-hmm. That's what that means. And when they say locally advanced rectal cancer, that means cancer that's greater than stage 1, which is just tiny. You have 4 stages: stage 1, stage 2, stage 3, and stage 4. Well, that would follow, right? What a genius statement that was. Anyway, but stage 1, 2, and 3 are local. And stage 3 particularly is locally advanced, meaning that it's gotten pretty big, but it hasn't spread to a distant organ or a distant site. So stage 4 cancer would be cancer where the tumor cells have moved to a distant site like the liver or the brain or bone or somewhere like that, and set up residence there and started to grow. Okay. That's stage 4 cancer, mm-hmm. and we would also call that metastatic cancer. So these are in people. That's the first thing. This is for people who do not have metastatic cancer in this situation. And then it says a subset of rectal cancer is caused by a deficiency in this thing called mismatch repair. And this is where you start going, okay. So this is a subset of rectal cancer. They're not talking about all rectal cancer patients. This study was specific to people that had tumor cells that had this genetic defect in them. So you would ask, well, what's the percentage of rectal cancers that have this particular defect? Do you know the answer to that?
No.
It's 5%. Or 10%. But that's it. Yeah. It's between 5 and 10%. So that means 90% of people won't be helped with this.
Okay.
On the other hand, the ones that do have this defect, they're resistant to standard therapy. Mm-hmm. So, if you, in the past, if you had this mismatch, repair deficient type tumor, it was hard to treat with neoadjuvant chemotherapy and radiation.
Okay.
So they didn't respond well to it. Well, now if you're in the 5 to 10% that have that, now we have this thing. This is what they're looking at. Now, they thought that people in cancer who spread to distant site, when they would block this PD-1 with other drugs, that there was some effectiveness. So in other words, in people with metastatic cancer that had this mismatch repair deficient type tumor, they thought, well, maybe these drugs will work for people with locally advanced. They weren't doing that before. So is this a breakthrough then? They already knew that this would work in people with metastatic cancer. Now they're looking at, if we catch them before they're metastatic, can we try it? Okay. And so, it's like, yeah, try everything. And if it worked in stage 4 disease, it'd probably work here too. And they did something different in this study, and they used a different agent, and that's what makes it interesting. So that part is interesting. Once you ratchet down your expectations a little bit and see this is in a fraction of people with disease that's hard to treat, and we already kind of knew that this mechanism worked when they were stage 4. Mm-hmm. And so now our expectations are down. Does it work in locally advanced disease, and do we have a drug that's effective? So what they did was they did a prospective study. We know what that means. People who listen to the show know what prospective means as opposed to retrospective. In other words, they do something and they follow people forward in time. And this is a phase 2 study. So we remember from the COVID talk, there are 4 phases to studies. Phase 1, small, and where you're looking to make sure you don't kill people. Then phase 2 would be one where you're looking for effectiveness. Phase 3 is where you're looking for less common adverse effects and effectiveness in a larger population. And then phase 4 is post-marketing, where you have hopefully millions of people that have been on this stuff, so you can pick out the 1 in a million adverse effects. So, and they used this stuff called dostarlimab, which is a monoclonal antibody, and it's an antibody that is directed at this PD-1 receptor site, programmed death 1 receptor site. And they gave it every 3 weeks for 6 months with this mismatch repair deficient stage 2 or 3 rectal adenocarcinoma. And adenocarcinoma just means cancer that is derived from glands.
Okay.
The way they set this thing up was they were going to do this dostarlimab stuff, and then they were going to follow it with chemotherapy, radiation, and resection. If they had anybody that still had residual tumor. So you got the chemotherapy people sitting there tapping their feet. The surgeons are ready to go, and the radiation oncologists are ready to go. And when they completed the study on these people, they had no people that went to surgery, radiation, because they all resolved their tumor. Wow. So it was gone in 100% of them. So the primary endpoint was sustained clinical complete response 12 months after completion. And so they had 12 patients, 114, Dr. Scott. It was 12. That's the problem. This is a very small study.
Yeah.
Let's just say this, and I'm not saying that this is true. I'm just saying let's hypothesize for a second that dostarlimab kills 1 people in 100 that take it, but it'll cure, 100% of people otherwise. we wouldn't know. We wouldn't be able to see that in 12 people. That's killing 1 in 100. You'd have to do 1,000 people, and then maybe 10 would die.
Right.
If you do 12, you're not going to see the 1 in 100. If it's 1 in 1,000, you'd have to do, 10,000, 100,000 to see.
Right.
And if it's 1 in a million, then that's going to be post-marketing. So that's the first thing is what they saw was effectiveness. Also, what are the odds? Let's say it was 80% that this stuff only works in 80%. I mean, we do things in oncology that'll have a 5 to 10% benefit. But if it was 80%, what are the odds that if you had any 12 people that 100% of them would be cured? It's not zero.
No.
Okay. So this is very interesting. None of them went to chemotherapy. None of them went to radiation. None went to surgery. And in no cases there was progression or recurrence during follow-up, and that was follow-up over 6 to 25 months. And they didn't have any adverse events worse than grade 3. So there's 4 grades of adverse events. And stage 4 or grade 4 events require hospitalization and termination of the study. Stage 3 is below that, but think things like asthma, bronchospasm, stuff like that. So, it's a great study. And for those people that had refractory rectal cancer before, wouldn't it be nice to not have to go through surgery and all those things? So this is a big step forward. We've said all along that the immunotherapy is going to be the thing that's going to eventually be the key to curing cancer, because the problem with cancer is immunologic. It's failure of the immune system to recognize these abnormal tissues in the body as being alien, because they're not. They're inside your own body. That's why it's so tough. But so it's a big deal, but it isn't as big a deal as, unfortunately, the medical journalism made it out to be, because they were like, well, in a couple of months we're going to have a complete cure for rectal cancer. And it's, we may, but it'll be for 5 to 10% of people.
Yeah.
Okay. That have rectal cancer. But listen, it's an outstanding result.
Oh, yeah.
And now let's see what happens when they do it to 1,200 people. Mm-hmm. And if they still get an outstanding result. What this may do for us is say, okay, this works in mismatch deficient patients. What is it about them that makes this work so well? And can we then translate this into other cancers that are similar? When you get a result like this, it tells you this is the key. We just now have to make it happen in other people too. So once you learn that, you can narrow it down. Mm-hmm. So it is a huge step in that regard. Mm-hmm. It's not a, like I said, well, I don't want to keep repeating myself, but anyway, okay.
Yeah, that's incredible, isn't it?
Yeah, it's very interesting. This is how science works, and we will see some stuff over the next few years that will be outstanding based on this type of research. So, okay.
I think it's pretty incredible.
All right.
Especially for that 5 to 10%.
Oh, yeah, absolutely.
Jeez.
Still phase 2, so it's not on the market. Yeah. But I used to say this stuff wouldn't help me. It might help my kids and my grandkids. Yeah. But no, this might actually help me
right on.
if I can hang on a couple more years before I get my rectal cancer.
Let's hope not. Pardon me. I was just thinking
You okay?
Yeah, I'm sorry. I think I got the same thing. You got a little between the 100,000 degrees outside and allergies. It's a little challenging.
It is a little warm today.
A little warm out here. It is. It seems to be that way across the United States for the most part.
What were you going to say?
Well, hell, now I forgot. I guess what I was going to say is, can they take this drug and put it into the data bank? Like we talked about a couple of shows ago, where if you have a certain cancer, they can biopsy the tumor and maybe put it in there and just see if it.
Well, sure, links up. You can always do that
moving forward. Yeah,
but this antibody is specific for this anti-PD-1. It's anti-PD-1, this programmed death 1 receptor or protein, and so antibodies are pretty damn specific. Now, if there are other tumors that have this, then they might be able to use it.
That's
for
what
them.
I was going to say. Yeah, isn't it true though? If they such profound results, they can fast track it through to where they can get it on the market more quickly.
Right, and we might got to be careful with that.
Yeah,
because we only have 12 people, so they've got to do a phase 3 trial.
Right.
I've never seen a phase 2 trial that only had 12 people in it.
Right.
But the monoclonals are different. I've not participated in a monoclonal trial. So I wonder how small their phase 1 trial was, if the phase 2 trial was only 12 people. But we want to, let's do a few thousand people. There's tons of people out there with, matter of fact, see how many, what's the incidence? That's what we want, the incidence of rectal cancer in the United States. Okay. Well, maybe we could ask Echo. Let's see if she knows. Echo, what's the incidence of rectal cancer in the United States?
Here's something I found on the web.
Uh-oh.
According to stateuniversity.com, there are about 36,500 cases of rectal cancer diagnosed per year.
Okay, so 40,000 cases. Mm-hmm. So that'd be 4,000 approximately of these mismatch deficient cases. And of those, you might get, I don't know, a fourth of them. So over the next year, we might be able to get 1,000 cases, if we can get that many into the study.
Right.
Okay. So, and maybe if they do 1,000 and they're still showing 100%, they'll fast track the hell out of that. Right, particularly if they're not showing any adverse effects beyond stage 3.
It's incredible. Yeah, it's incredible.
All right. One thing you might want to look at is look at what tumors have PD-1 or PD-1 sensitive tumor, something like that, while we're doing the next thing.
Okay.
All right. Let's do this one. This is pretty interesting. You ready?
Yep.
Okay. While you're looking that up. This is one about transcranial magnetic stimulation.
Hey, Dr. Steve, it's Calvin from California.
Hey, Calvin.
So I saw an advertisement on a mobile game for something called the TMS, Transcranial Magnetic Stimulation to Treat Depression. And I think this sounds like a bunch of phrenology bullshit. I was wondering what you guys were thinking about. So anyways, thank you so much, and have a wonderful day.
Okay, man. Yeah, some of this stuff can sound like horse manure, but I'm looking at a study here in a reasonably, this is from Cambridge University Press, really from 2001, so it's not a new thing. And it's called repetitive transcranial magnetic stimulation for depression and other psychiatric disorders. Mm-hmm. And they looked at 7 controlled trials. 5 of them were suitable for what we call meta-analysis. That's where you take the data, mush it all together, and then re-look for statistical significance. And they showed beneficial effect compared to placebo with a number needed to treat of 2.3 with a 95% confidence interval. So what that means is you would get it's significant enough that if you treat 2 people, you're expected to get a positive benefit. Mm-hmm. That's not bad.
No.
Because you got to treat 30 people with a statin to prevent 1 heart attack. Right?
At least 30.
Yeah. We've talked about number needed to treat before. If someone has a question about that, call in and I'll go through it again. But so, yeah, it doesn't sound ridiculous. They did do a controlled trial in people with schizophrenia, which would have been cool if it had worked, but it didn't.
Mm. Hey, can I talk about that a little bit too?
Of course.
With the transcranial. You're in that's in my world now. You're talking where all the freaks hang out a little bit. No, but 100 and some odd years ago, they started doing a lot of research on electric frequencies into the body on cells, and it's this thing called Rife frequencies. Something that I use occasionally. We have a little machine that does some of this.
Oh, no.
Here we go. No.
Rife?
Well, let me finish there.
No, it's okay. I'm looking it up.
Yeah, it's right. Yeah, the Royal Rife. He was a physicist in Germany. R-I-F-E. And he was a physicist in Germany in the early 1900s. And so anyway, but the machine, Dr. Steve, they're doing some of this transcranial electrical stimulation at NIH for glioblastomas.
Okay.
And also, if you think about this, how much different is it from an ECT? That they do
very different.
Well, but you're shooting electrodes in electricity into the head.
Yeah, but okay. Do you understand that ECT? It's not the electricity.
Mm-hmm.
It's the seizure that it induces. They used to do ECT with insulin, and they would give people a shot of insulin, drive their blood sugar so low that they would have a seizure, and that would work. Yep. So it's the seizure, not the electricity.
But the electricity causes a seizure.
Well, that's right. That's right.
Well,
it's just a different way to cause a seizure, because doing it with insulin sucks.
Yeah, no insulin. Yeah, doing it with insulin is terrible.
Yeah, right. But it's not. It's not the electricity that's giving the beneficial effect.
Well, at least for the most part.
It's the seizure. It's people who were. What they found is that people who were post-ictal, in other words, people that had a seizure, that their depression seemed to get better. So they induced seizures back in the day with insulin, and there are other ways that you could do it. But then they found that if they gave someone propofol or something to anesthetize them and then touch them with electricity, it could induce a seizure, and then that tended to make refractory depression better. But we have other stuff now like ketamine that we can talk about. But anyway, go ahead. I'm looking at Cancer Research UK on Rife machines and cancer. But go ahead.
Well, that was my main thing. I don't know exactly what he was talking about or that study, but I have seen for years they've used certain kinds of electrical stimulation to treat all kinds of things. Yeah. Certainly we do it for muscles. Uh-oh, what just happened?
I don't know.
Yeah, I can't hear
anything. Thing.
On my
headset. Jiggle it around.
My headset went dead. Yep. But the treating muscles and nerves and things of that nature with electrical stimulation. So you would think at some point there may be a way to treat depression for sure.
Okay. I'm looking at Rife machines as a cancer treatment, and this is considered severely alternative.
Oh, yeah,
it says has not been through the usual process of scientific testing. There's studies that looked at low energy waves as a treatment for cancer, and they did a study on a small number of people with advanced cancer, and they had a type of liver cancer called hepatocellular carcinoma. And the researchers found that low-frequency waves affected cancer cells and didn't affect normal cells, but they didn't show that it actually did anything to improve the outlook of the patient. So the Rife machines are expensive. They basically are low-energy electrical impulses that are sent through the hands or feet, and they are most likely radio waves, and it's just a different thing altogether. So since they found out that cells respond to electricity back in the day, and I can't remember who it was, whether it was Volt or Hertz or one of those guys that stuck electrical wires into the muscle of a frog and watched it jerk, then we've had all kinds of quote unquote electrical therapies come out from lots of different things, and some of them persist to this day, and many of them are quackery. I'm not saying that the Rife machine is. I don't know enough about it. All I know is that there haven't been enough data generated to show that it does anything. And that is really quantitative and qualitatively different than doing electroconvulsant therapy, which in that case, the convulsant, the C in ECT is really the important thing.
Okay.
Now, for refractory depression, we've got other stuff now. I know they still do ECT, and it is a last resort. And these days, we have esketamine. And esketamine is related to ketamine very closely, known on the street as Special K, and it has an onset of about 3 days, whereas if you take a selective serotonin reuptake inhibitor, SSRI, like Prozac or fluoxetine or sertraline or one of those, it can take 8 to 12 weeks to kick in. So this stuff, particularly, I'm interested in it because a lot of my patients don't have 8 to 12 weeks for their depression to get better. And but the problem with esketamine is it's ridiculously expensive, about $400 a dose. And you have to have a special REMS license. That's a sort of risk evaluation management strategy thing. And you got to have a special pharmacy. And when you write it, the pharmacy's got to deliver it. Then you got to give it in the office and keep the patient in the office for 2 hours. Whereas you really, if you go to a compounding pharmacy, you can get a ketamine suppository for about $5. So it is a bit of a jacked up situation with the ketamine nasal spray.
Yeah.
But anyway, that's pretty interesting. And I bet we'll see if we can get some adoption of the ketamine, we'll see another decrease in the number of electroconvulsant therapy patients. But that's sort of a side
People
issue.
tolerate the ketamine pretty well?
Yeah.
Do they? Okay.
Yeah, they do better than tolerate it. They kind of like it.
Right on.
It's a dissociative anesthetic, so you sort of feel like you're in another world for a little bit. And then when you come down, your depression's better.
Huh.
It's pretty interesting. Not to be
confused
in the street. Don't go buy Special K on the street if your depression's bad. And none of that. Do this the right way if you need it. But if you know someone that's got refractory depression, that's been on all of the stuff, and they've been on duloxetine, aka Cymbalta, they've been on fluoxetine, aka Prozac, and maybe they've thrown some Abilify in there or some other, add-on medications, and they're still severely depressed. Ask their shrink about esketamine.
Yeah, because once you get to that point, there are not a lot of choices remaining. Yeah.
And I think the branded name is Spravato. Let me see if that's right. Spravato. Yeah, Spravato.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
ABC Wednesday. It's the premiere everyone is talking about.
I'm Joan, and I'm your first Golden Bachelorette.
Loves getting a second chance.
When you're 61 years old, you have very few opportunities to change your life. I have to be ready.
The Golden Bachelorette is proving romance never ages.
I represent millions of people in their golden years looking for love.
The Golden Bachelorette.
I am ready to find the next great love of my life.
Series premiere Wednesday on ABC and stream on Hulu.
Hi, I'm Lara. After 20 years of making Lara Bar, I still believe that simple and real can be indulgent and delicious. From chocolate chip cookie dough to cherry pie, there's a Lara Bar made for you. 100% real, 100% delicious. Find your flavor at larabar.com.
Bring fun to life with the Instax Mini-Link 3 smartphone printer. It's easy to transform your everyday moments into colorful Instax mini prints straight from your smartphone's camera roll. And with the new Click to Collage feature, you can create the ultimate in-app photo booth experience. Instax Mini-Link 3. Don't just take, give. Click or tap now to learn more and shop.
All right, and if you know anybody that's tried it, have them call in.
Yeah, Sean just said he does have a friend that did that and did exceptionally well.
Really? Okay,
yeah, cool.
Good to know. All right,
cool.
Thanks, man. Excellent. All right, you got it. You have another story though, right?
Well, yeah, we've got a couple. Actually, do you want to talk a little bit about the Ramsay Hunt, or do you want to talk a little bit about
so that's interesting. When Justin Bieber's face went numb, I initially thought, well, why are they making a big deal out of Bell's palsy? But that's not really what he has. That would be the first thing people would think about, Bell's palsy being a paralysis that's often temporary but can be permanent in some people, of the nerve that innervates the muscles of the face, and it comes through a tiny little hole in the skull. And if there's any swelling of that nerve, what happens, it cuts off the blood supply to the nerve, and it just goes limp, and you'll get one-sided facial weakness. But that's not what happened to him. Why don't you talk about it?
Yeah, evidently he's got a whole lot worse than a Bell's palsy. It's Ramsay Hunt syndrome, which also known as herpes zoster oticus. My God. It's a late complication of varicella zoster
here we
virus.
go. Okay, well, you got that right.
Yeah, well,
I'll give you
Give yourself a bill.
But it presents a little bit like Bell's palsy, but it's profoundly worse.
Yeah.
The outcomes are not as typically positive as Bell's palsy. Typically, if we intervene with Bell's palsy early, we can get it corrected pretty well. But something I was reading about that I didn't know about Ramsay Hunt. The one thing is, when the nerves start to grow back, sometimes they will grow back, and the nerves will connect to nerves that they weren't connected to earlier, and they'll actually get different muscles moving in different ways. Like if they close their mouth, it might close their eye. If it closes,
What?
Yeah.
Now, I had not heard.
Yeah, I had never heard that. It's called synkinesia. Oh yeah, synkinesis. SYN.
Syn means together, and kinesis means movement.
Yeah, Dr. Steve, and I'd never heard that at all. But what they're saying is that occasionally what does happen is when, because what will happen is like with Bell's, and I can speak a little bit more to Bell's palsy than the Ramsay Hunt, but when those nerves start to wake up and they start to re-innervate, like you see anytime with a peripheral nerve damage, which is certainly different from his central nerve, but when they start to
this is a peripheral nerve. It's the facial.
Well, that's
nerve.
what I'm saying. Yeah, it's different from his CNS, but when those nerves start to regrow, people will tend to get tingling. They'll get pain, and it's not always the most comfortable thing.
Right.
But what they're saying with this is that they can actually develop a degree of synkinesis, which is extremely rare, but has been shown.
Well, if you make your living singing, that would suck.
Oh, geez, Louie, yeah. You're trying to close your eye and it's closing your mouth, or vice versa.
Right.
Yeah, it's
good Lord.
Isn't that incredible?
Well, so in this Ramsay Hunt syndrome, it's previously inactive varicella zoster virus gets reactivated and spreads to affect this facial nerve, and they'll have a rash on the ear or the mouth. They may have ringing in their ear. They may lose hearing on that side, and then they'll get this facial nerve paralysis. So that's a rough one. How do you treat it? Herpes stuff.
Yeah.
Same thing that you would treat shingles with.
Right.
Valacyclovir, acyclovir, whatever that other one is. Famiciclovir, yeah.
And what about steroids?
Famiclovir, that's it.
And steroids too, I would assume.
Oral steroids,
probably.
With oral steroids to decrease the swelling, and then they want to start the antivirals within a couple of days.
Yes.
And so treating this promptly is the key. And I'm assuming that he's got good. He's not one of these that calls me, so I'm assuming he has his own cadre of physicians that work with him, so they caught it early. He should be okay, but it'll be interesting to see. So hopefully we don't want anybody to have that. Now, if they have horrible pain, then they may use an anti-seizure medicine called carbamazepine, and that can be really good for pain of that, in the facial nerves. The trigeminal nerve, which is a sensory nerve in the face, and if that gets infected, it can cause severe pain.
Yep.
People, if you've ever heard of tic douloureux, that is also called trigeminal neuralgia. That can be so severe sometimes that people really want to do themselves in.
Yeah.
And I've seen some people that had that were just in 10 out of 10 pain. I mean, writhing, screaming in pain. And I watched the ear, nose, and throat guy take a big giant needle and stick it up under their lip, up to where their cheekbone is, and infuse it with anesthetic. And they just all of a sudden they just stop, and they're just sitting there talking to you till it comes back.
Yeah, till it wears off.
So some of those folks, that's a tough one, but a few percentage, and it's a decent percentage. I've had maybe 50-50 luck treating that with carbamazepine, but there are other things that you can treat it with. So,
yeah, and may I say also that acupuncture has been shown to help with Bell's palsy. Ramsay Hunt, tried
Really?
doing all those things. Yeah, I sent you that. I sent you a link.
You did?
Yeah.
Well, why don't you give us the data then? You have it in front of you?
No, I can't find it.
Okay.
But I'll look at. I will look at it. But no, I sent you that
Okay.
the other day. Well, so I'll find it. I'll find it. But I will say that.
It's
let's
5
just
out of
say-
every 100,000 people. So people are listening to this. If you've never heard of it, that's why.
Yeah, there's not a.
It's not very common.
Not a whole lot of people.
But if you've ever had chicken pox, you can get Ramsay Hunt syndrome. It's usually in people who are older, and hopefully all of those people have gotten their shingles vaccine, because it's basically shingles of this particular nerve. And so if you don't want to get Ramsay Hunt syndrome and you're old enough to get the shingles vaccine, get it. Because I am here to tell you, I got shingles after taking the Zostrix vaccine. That was one of the few breakthrough cases that people can get, and it was literally gone within 2 days. That's how easy it was.
That's unbelievable.
Yeah. So I'm a firm believer in the shingles vaccine. All right. What else you got? You got anything from the waiting room? If not, I've got.
I've got good news. Yeah, I've got.
Go ahead.
Good news from Movie Messiah. He said he's practicing. He and his wife are practicing the treatment. I'm sorry, I'm trying to find
That's
the damn
okay.
thing while I'm trying to speak. Anyway, not ejaculating too quickly.
Oh,
the
delayed
ejaculation.
Oh,
thing.
was that him?
Yeah, it was Movie Messiah. Yeah, he said he thought 60 seconds was adequate, which I'm saying.
Of course.
I'm like, why are you doing it that long for? And wasting you're wasting a whole half a minute. But he said the Movie Messiah is doing pretty well with
Good. Yeah. So go back a couple of, well, it was
Yep.
quite a few shows, and we talked about the techniques for delaying ejaculation if you have premature ejaculation, which, by the way,
according to your,
is judged by
according to the other person.
The other person usually, right?
I never thought I had an
But
issue.
premature ejaculation is anyone that ejaculates sooner than they think they ought to. That's all it is. There's no definition for that. If you're is it Movie Messiah?
I think so.
You think so? You're the one that's reading it. I'm trying to find them. But anyway, if he were with my wife, they'd be fine.
Yeah.
Because she likes a quickie, and I'm,
Movie Messiah,
on going for 2 hours, and she's like, "Oh God, can we get this over
Can we hurry
with?"
up and get to the end of this so I can get back to my nap?
Yeah. So
she's retired,
Yep. Well, apparently she doesn't have any time for that kind of malarkey. She still wants it over with quickly. Of course, I'm 66. I'll be 67 pretty soon. And if I were having some 67-year-old laying on top of me, grunting and...
That's right. With one bad toenail,
Well, I don't have any
gouging
bad toenails.
gouging you.
Thank you. I used to. I got them removed just because of that. But I would probably want it over quickly too. Just get it over with already. Just let me go anyway. Let me go pay for it, and then they won't care. Just put another $100 on the table.
I love it.
All right, you got any other stories?
No, not right now.
Okay. All right. And let's try this one then. Oh wait, let's try this one.
Hi, Dr. Steve, Dr. Scott.
Hey,
how are you guys?
Hey, good.
Great.
How are you, man?
Hey, that's great. No shit. Anyway, since about the summer of 2018, I've had a red, itchy rash on the left side of my groin. There's days when the itching disappears, and I can go maybe a whole day without a problem. And then there are days when I can't stop scratching it.
What? It's on the side of his what?
That's what I was going to say.
Oh, God, I don't know.
I couldn't hear it either.
Let's run it back and see. Sorry.
And I've had a red, itchy rash on the left side of my groin.
Groin?
There's days when...
Wait a minute. Let me mess with the audio a little bit. I was an audio engineer, you know. Let's see here. What can we do here?
Red, itchy rash on
left side of something.
I've had a red, itchy rash on the left side of my groin.
I'm going to say groin.
Itching disappears, and I can go maybe a whole day without a problem. And then there are days when I can't stop scratching it. I try my best to not scratch it because I know it's probably making it worse.
Yeah.
I went to a dermatologist about 2 years ago, and he said it wasn't fungal. I tried every over-the-counter antifungal cream I could find.
Okay.
To no avail.
Well, we already know what it is.
The dermatologist's diagnosis was, he said either lichen planus or lichen sclerosis.
Maybe.
And he gave me 2 different topical ointments to try out. The redness is always there, though, but sometimes the rash appears to be more reddish and raised. Other times it's lighter in color with like flaky, dry-looking skin. I'm tired of living with it.
I really want to hear this whole thing because we may get a clue.
Yeah, me too.
It would probably come back after I stopped taking the ointments, and I was back to normal for 1 to 2 weeks after the treatment ended, and sure enough, it came back.
Yeah.
I've been pretty much just living with it ever since. I'm trying to do what I can with it. If the diagnosis is correct, either lichen planus or sclerosis.
I don't think so.
Is this something that I'm going to have to live with? Should I get a second opinion?
Yeah, I would. Okay, so here's the thing. Lichen planus is an immune disorder where the immune system attacks cells of the skin or the mucous membranes. They're purple polygonal papules. That's how we remembered it. So they're purplish, itchy, flat top bumps, right? Mm-hmm. And then when you get them on the mucous membranes, they're lacy white patches. That's not what he said.
No.
Okay, so then lichen sclerosis was the other thing. That's patchy white skin that appears thinner than normal.
Mm-hmm.
And now that's genital, but also anal areas.
Okay.
And most people, postmenopausal women are at higher risk of getting that, but anybody can get it. Neither one of those sound right. This is what I recommend that he do. Mm-hmm. And we've talked about this before because no one thinks about this, sometimes not even the dermatologist. Put a black light on it. Go buy one.
Yeah.
It costs you $10 a
little black light flash.
A little black light. Well, get a good one. Get an actual black light from like Amazon. And do you remember what I'm looking for? It's
no.
okay. Okay, so you're looking for that rash, that place that's red, to light up a beautiful salmon color.
Oh, okay.
I had somebody on Twitter. This happened just the other day.
Wow.
And if it lights up a beautiful salmon color, it's not any of these things. And so they're right. The steroids won't work and the antifungals won't work. It is a thing called erythrasma.
Okay.
And erythrasma is called by a corynebacterium. You treat it with antibiotics.
Okay.
And when you do that, it'll go away and stay away.
Okay. Orally, topically?
Yeah, orally.
Okay.
Yeah.
Gotcha.
And I'll have to look and see if topical antibiotics will work for it. But I think you got to work on it from underneath.
Oh, wow.
But
okay.
That's a great question, Dr. Scott.
Yeah.
Let's try topical. You look that up because
I will.
Carl always hates it when I Google stuff when I'm on the air. So it may be this erythrasma thing because it doesn't sound like either one of those things from what he described. That's why I wanted him to keep going, see if maybe he would give us another clue. The one clue that he gave us was, you treat it, it just comes right back. And or antifungals don't do anything. Yeah, so when I hear someone says that I think it's a fungus, I've tried every antifungal and it doesn't do anything. One of the first things I think about is erythrasma because nobody thinks about it. So this person on Twitter the other day said, I've got this jock itch. It won't go away. And I said, do you have a black light or, put a black light on it? I guess either went and bought one or he had one. He was probably a hippie from the 60s. And he had a black light. And he said, it glowed bright, salmon pink. And I said, just go to your doctor and tell them, I think I have erythrasma. And if they look at you like you're stupid, bring in your black light and give them this article.
Wow. Yeah, Dr. Steve, it looks like some clindamycin topically might work. Yeah.
Fair enough.
Cool, yeah.
Thank you, Dr.
I mean, I guess it'd be worth a try topically first.
Oh, I would do it topically.
Yeah, I would.
If you can not take a pill that has to go to the tip of your nose to treat a rash in your groin, then that's fine.
Yeah, cool.
But yeah, okay. So I'm concerned that may be what that is.
You should give yourself a bill.
Should I?
You
okay.
Give yourself a...
There you go. Good stuff.
You get nothing. You lose.
Okay. All right. Let's move that one to the trash. Let's see. Oh, here's one for Dr. Scott.
Oh, no.
Okay, that's a good one.
Hey, Dr. Steve. Bob and PA.
Hey, man.
Listened to the show forever, and I never thought to call in, but I was wondering, I just noticed right about lower back, my spine does a little curve and then goes straight into the lower back. Is that a problem? Should I do something about that, or is it going to be all right? Thank you, sir.
Okay. So the first thing, he doesn't say that there's any symptoms with this.
Right.
So
Yeah.
What do you think?
Well, the first thing I'd say is, has the curve been there for a while?
Yeah, well, he doesn't know. He just noticed it.
I would get an X-ray just to look at it. It might be a little bit of scoliosis starting to develop as you age, depending on which way it's
be
curving.
normal.
Could be completely normal, yeah. Because normally in your lower back you've got the lordotic curve, so it kind of curves.
So lordotic means that it's facing toward the front. Mm-hmm. Okay, and then
it should tuck back out where the bottom of your spine goes into sacrum and coccyx, kind of pokes back out. So in that lower part,
nobody knows what sacrum or coccyx are.
So
your tailbone and that flat
tailbone.
bone and just above your ass.
Yep.
Right. Okay.
Yeah, so you can kind of poke, the very end of your spine, which is your tailbone or coccyx. But that should have a natural curve, and that curve is there for springing as a shock absorber, which so you want that curve there. But if it starts to get too far one way or the other, if it's too straight, or if he's getting a curve from side to side, then we start.
I'd actually be more concerned if it were straight.
If it's dead straight, that's a big problem. That's a big problem.
People think it should be, but it shouldn't be.
No.
If you look at just Google lumbar spine X-ray, and you should see a sideways view, and they'll always have that kind of S curve in it.
Yeah,
and it looks more pronounced than you would think it would, but it's actually quite pronounced.
Well, and Dr. Steve, I think a lot of people don't appreciate the fact that there is a vertical load if everything's lined up perfectly, but that curve is there for a spring, because if your spine was completely in a straight line vertical and you got hit on top of the head, or you fell straight on your rear end,
or just walked off a curb,
or everything would just explode. It'd pop instead of bouncing. So I would.
So I think what happened was he's moving around on his back and goes, whoa, I don't know if this was there. Let's call Dr. Scott.
Yep.
And we see this quite often, actually.
A lot.
People are not as in tune with their bodies as you'd think they would be. I had a guy come in, well, let's say, again, I heard about a guy that came in and he said, I think I've got a tumor in my spine, or in my chest.
Okay.
And he said, yeah, it's right here and I can move it around. And this person examined this person's chest, and what they found, it was their xiphoid process.
Okay.
And the xiphoid process has been there since he was an embryo.
Yep.
And it's at the very end of your chest bone, the sternum, where all the ribs meet in the front. You have this flat bone we call the sternum. If you go down to the bottom, there's this kind of pokey thing. It feels like feels like a mass. It's rounded.
Yep.
And if you poke on it, you can bounce it kind of in and out. Don't do it too hard, but you can bounce it in and out. And that is your xiphoid process, and it is connected to the sternum with cartilage, and that's why it's kind of springy like that.
Yeah, it kind of wiggles a little bit.
And if you never noticed it before, you could be 30 years old, and then you're feeling around and go, oh, God, what the hell is that? And then you come in to see your doctor, and they charge you $150 to tell you that's always been there since you were an embryo. So there you go. Not a reason not to go if you're worried about something.
Of course, yeah.
But that person, from what I hear, was extremely relieved, and it was worth it.
Yeah,
worth the visit. So.
And I think this guy, if it's something he's not sure has been there for a while, go.
I don't even know if I do an X-ray. Just let somebody look at it.
Yeah, because typically, if we can look at somebody, Dr. Steve, if they're facing away from us or even towards us, we can see if their hips are out of alignment.
That's right.
If one hip's higher than the other, we can have them stand and bend forward away from us, and we can actually kind of see the spine.
That's an interesting one for scoliosis.
Yeah, it is. But that just might help you Just to,
if you want to see if somebody you're with has scoliosis, it's a fun test. You stand face to face, step back a little bit, and have them bend over and touch their toes. Now you assess how straight. I mean, could you put something on their back like a ruler, and would it be level? And then have them come up slowly with their arms extended toward the ground. And when you do that, if they have scoliosis, you'll see one side will go up before the other, and it's really pronounced. And that's when I found out I had scoliosis. So I'm about 2 inches shorter than I'm supposed to be because of all that stupid shit in my spine. Anyway, anything else out there? Oh, I see Love It is out there in the waiting room. For people who don't know what we're talking about, we do live stream usually on Wednesdays to record this show. So you can come hang out with us and just watch my Twitter feed at Weird Medicine or subscribe to our YouTube channel. We're back on YouTube, not for any good reason, just because I couldn't find another place that had a user interface that I could make work. And now that we've left and come back, I keep getting this keyframe frequency error. I don't know what the hell's going on. This live streaming sucks.
It's a pain, but it's good to see our friends.
Yes, it is so much fun to hang out with all these people and stuff. And then, we'll answer questions offline. We play stupid, really not good songs, and things like that. Dr. Scott will play, and I will learn a song while you're watching us, and then we will play it badly, and then we will forget about it and never play it again. It's the dumbest way to do music I've ever heard of. But anyway. All right, Dr. Scott. Well, before we get out of here, we have some questions from the waiting room. What do you got?
Well, continuing in our theme of dermatology. Yeah, we've got a good one from Sean. Sean's asking, what is swimmer's itch? What causes it, and how is it treated? He saw some discussions on Twitter about it.
Okay. So swimmer's itch is kind of a different thing. If you look at the CDC website, it's called cercarial dermatitis, and it's caused by allergic reaction to microscopic parasites. And it's usually they infect birds and mammals, and so they're released from infected snails into fresh water and salt water, like lakes and ponds and stuff. So I don't swim in those.
No.
I used to swim in fresh water all the time. Now, if you go to Tahoe or something, I'm kind of okay with that. But to just have somebody have a pond in their backyard, I'm not swimming in that shit.
No. There's bird poop in there. And
there's all kinds of stuff. And it doesn't get to the right temperature to kill certain things, and God, don't get it in your mouth.
No, but it gets the right temperature to grow some little parasites. And
if it grows amoebas,
skin,
and you dive down and it gets up in your nose, you get amoebic encephalitis and stuff like that. So this is just me. I'm not saying anybody else, but for me, I don't swim in fresh water anymore. Salt water is a lot better, but then hell, you got jellyfish and stingrays and shit like that. But, you wonder, well, how in the hell does water become infested with these parasites? They get into ducks and geese, and then the parasites produce these eggs that are passed in the feces because they just shit everywhere. Well, they don't really shit. Ducks don't have rectums. They have cloacae. And what a cloaca is when you've got your urine outlet and your stool outlet coming out of the same place. So back in the day when the joke, and it's hilarious, ladies, when you would do a delivery, if the kid's head tore the vaginal wall down into the rectum, that happens. It's called a stage 4 tear. You've got to sew up the intestine, the rectum, and then the vaginal wall and all that stuff. And it takes some special skill to do that. They would use, the joke was, oh, did you make a cloaca? So, it was hilarious. I mean, we can't laugh about this stuff anymore. I guess it's not funny. If you get your vagina torn into your rectum, you don't want some asshole redneck doctors making jokes about it.
No.
There's other jokes, though, like the Emerson Gooden sign. I'm telling you this not because I think it's funny. I'm telling you this as a cautionary tale about how people used to objectify people and make fun of their maladies back in the day. I'm talking in the 70s and stuff. Back when people still smoked in hospitals and things, there was this thing called the Emerson Gooden sign. Do you remember what that is?
No.
That's when you're looking at a chest X-ray of someone with large breasts, and then you're looking at the X-ray and you point at the shadow of the large breast. You go Emerson Gooden.
Emerson Gooden. So there you
go. Again, not a. I'm telling you this not because I find it funny, but as a cautionary tale to combat things like that in the workplace. But anyway, so they shit out. They cloaca out these parasites into the water. They land into the water, and then they're just constantly you've seen when geese go overhead. You've got to watch it because one of them is going to take a dump on your head, and then the eggs hatch in the water, and they get these free swimming microscopic larvae, and they swim in the water looking for a certain species of aquatic snail. This is quite the life cycle. And then if they find one, they infect it, they multiply, and then they undergo this sort of further development, and then they release a different type of microscopic larvae, and these are called cercariae, and hence the name cercarial dermatitis, into the water, and those swim about looking for a suitable host that usually is going to be a bird or a muskrat or something to continue their life cycle. Now, we are not suitable hosts, but they can burrow into your skin and cause thinking, because they're stupid, right? They're just skin, and they just burrow in looking, I live here, and then your body kills them, but then you get an allergic reaction to it.
Yep.
So that's how parasites talk.
There you go.
Like
hillbillies.
Yeah, like Deliverance.
There you go.
All right, and it's like scabies. You get these blisters. It's real itchy stuff like that. Hopefully that answers your question. And more if you get it from a certain pond that you're swimming in, unless you kill the snails in that pond, this will continue. I don't advocate killing the snails. I advocate swim in a pool.
Yeah, swim
Find
elsewhere.
Effing pool.
Yeah.
And so the things will die. You use they'll use steroids and baking soda paste and stuff like that to treat it.
Salt baths, etc. Things like that. Yep.
All right.
Well, last one. Our old buddy Richard Kish has a question here.
Okay, Richard Kish, who knows good music.
Yes, he knows good music. He said, "What's your take on demon scratches?"
Demon scratches.
Yeah, usually
I don't know what the hell that
they
is.
usually show up in threes, and no one, like my wife, knows where they come from. She got them again recently.
Okay.
I
don't know. I think you're scratching yourself.
I think she's scratching.
Listen, I'll tell you what we'll do though. NASA has an article about it, and no, that's okay. That's about scratches on the surface of Mars, and that's caused by whirlwinds that dig up circular scratches on Mars because it's got a very thin layer of dust. That's a different thing. So they have dust devils and they leave marks. I'll do some research on this. We got to look for next time. I have no idea, but I will tell you this. I used to do ham radio from a place in North Carolina called the Devil's Campground.
Oh.
Ooh, scary kids. And the Devil's Campground was this circular place in the woods that nothing grows. And if you sleep in there, the next day you'll find all of your camping stuff on the edge of the circle, as if some supernatural force forced you over to the edge of the circle because they didn't want you in their circle. We did ham radio there. All we saw were a bunch of rednecks going, "There's Devil Campground," and drinking beer and throwing beer cans around and stuff, and going, "What are y'all doing? Is that what channel are y'all on? Is that channel 19?" So we weren't doing CB. No, we were doing amateur radio, my friend. But anyway,
I love it,
Scott. Yeah, I could tell you love that story. You're otherwise occupied. But anyway, so I find those things to be malarkey. My wife likes to watch ghost shows, and I remember her saying that on the third floor, but the ghost shows where they put a GoPro on, and then they turn out the lights and they scare themselves, right? And they get all scared and, "Oh, did you see that?" And it's like, "No, it wasn't." And it's like, "I don't know. I didn't see anything either." And they would tell you, I said, "Tasty, why are you watching this?" She said, "Well, on the third floor of this hotel, 3 people died, and now it's being visited by poltergeists. And I said, if that were true, every room in the ICU, the paintings would be flying off the walls, and you'd hear "Get out!" And it's not. It doesn't work that way. No. It's not right. It's BS. All right. Thank you, my friend.
Thank you, Kush.
Kush, why do you call him that?
The first time he put his name on there, I read it as Kush.
Because you're a hippie.
Because I'm a hippie.
And you used to do Kush. What is Kush anyway? Is that like Vietnamese pot or something? What is Kush?
Yeah, Kush is just a fancy name for fancy weed.
Kush cannabis. What is that? It's something though, isn't it? A real thing? Okay, Kush cannabis come from Hindu Kush Mountains. Okay.
Oh, okay.
I was thinking it was Vietnamese, but it's from the Hindu Kush Mountains. Okay, well that makes sense. All right, fair enough. Mystery solved. Anyway, we can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teft, Kim Chickens, Richard Kish, Shawnee P., That Gould Girl, Lewis Johnson, Paul Ovcharsky, Chowdy 1008, Howdy Gooplunk, Eric Nagel, the Port Charlotte Horror, the Saratoga Skank, the Florida Floozy, the St. Pete Barkeep Blower, the Dolly Museum Diddler, the Ballet Bimbo, the girl with the genetic half-sister no one knows about, Percy Dum, Roland Campos, sister of Chris, Sam Roberts, she who owns Pigs and Snake, Pat Duffy, Bill the Cop, Keith the Cop, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, Christopher Walken's voice double, guitarist Steve Tucci, the great Rob Bartlett, Adam Goldstein, Cowgirl Vic, thank you for your service, ma'am, Cardiff Electric, Casey the Soil Scientist, Carl of the Talipes Equinovarus Carls, producer Chris, the subreddit News Chick, a.k.a. That Broad, Crows and the Bukkake Queen, Jenny Jingles, the Inimitable, Vincent Paulino, everybody, Eric Zane, Trucker Andy, Tucker and Anita Dixon, the original Shawty I've got written here, she is not a tall woman, Bernie and Sid, Martha from Arkansas's Daughter, Ron Bennington, and of course our dear departed friends, G-Back, Barry the Blade, and Todd Hillier, who supported this show, was always gracious and always appreciated. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand and other times at Jim McClure's pleasure. Oh, many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody. Thank you, Scott.
Thank you.
Yeah, go fuck yourself.